Thank you very much, dear colleague Thomas Rachel, dear Mr. Turner, Professor von Kalle, Professor Pries, dear ladies and gentlemen. I would like to welcome you on behalf of Minister Jens Spahn, who can't be here today, but he gives you his best regards. Today we are all here to exchange views on the future of medicine and on what is new in the health science and on the challenges the health system is facing. As the next speaker, after my esteemed colleague, I would like to look at this topic from a health and a care perspective. I would like to start with a vision on how I see the future of medical care. Imagine you have an emergency and you have to go to a hospital you have never been before. Imagine that the staff is already expecting you. They have all necessary files from your electronic health record, have already arranged the admission digitally, are right there waiting for you when the ambulance arrives to the emergency room. Ideally, your general practitioner is telemedically connected through trauma board. The MRI and all other necessary examinations are being scheduled in real time during the physical examination via automated speech recognition. Personalized medicine at its best. And it is our aim. It is our aim that it becomes a reality. Dear ladies and gentlemen, the healthcare system has always been based on innovation and progress. The patient should and must be at the center of all these innovation. Digitalization is not an end in itself. It is a means to better, more human care. It should be used to support healthcare professionals, to give them more time for what they do best, taking care of their patients. How can the medicine of the future become less bureaucratic and more emphatic? What added value does digitalization bring? And how can communication between researchers, clinical research and physicians be promoted and coordinated? These are questions that concern us all, scientifically, socially, and of course politically. Also, and above all, in the healthcare sector. In the following, I would like to tell you about how we at the Federal Ministry of Health intend to shape digitalization in concrete terms. First of all, we started with ourselves in order to bundle the processes and resources. The Department of Digitalization and Innovation in the Ministry was established. In mid-May of this year, the government structure of Gematik was adapted. In June 2019, we launched the Innovation Forum Digital Health 2025. Another important step towards shaping digitalization is the Digital Care Act. Today, the Parliament will, hopefully in this afternoon, adopt it. The Digital Care Act provides numerous measures to facilitate access to digital innovations for standard care, to accelerate the development of innovative telemedical care services, and to give new impetus to the development of innovative care approaches. Ladies and gentlemen, what we need is a clear path that evaluates good innovations in realistic timeframes and integrates them into care so that all patients and all doctors can benefit from them. Therefore, the Digital Care Act will establish a new administrative so-called fast track to evaluate mobile health applications such as apps. The new procedure for digital health applications will be carried out by the Federal Institute for Drugs and Medical Devices. Also, services of physicians which are necessary for the employment of the applications are recompensed. In addition, telemedicine is to be promoted across sectors. For all this, we need a secure and trustworthy communication infrastructure, the so-called telematics infrastructure. We should network all those involved in the healthcare system across sector and across institutions. By the end of this year, all doctors in Germany and dentists' practices should be connected. Further services provided, such as hospitals, pharmacy, and nursing and rehabilitation facilities, are to follow through Digital Supply Act regulations. Dear ladies and gentlemen, in addition to these data highway, another core element of digital healthcare is needed, the electronic health record. Health insurance companies must provide their insured persons with an electronic health record from January 2021 onwards. Upon request, insured persons will be able to access their electronic health records with their smartphone or their tablet. The electronic health record is the essential instrument of digitalization for improving the exchange of information across institutions and the quality of medical treatment in the healthcare system. Apps, telematics infrastructure, electronic health records, e-prescription, that's the basis. But digitalization can do even more through the use of artificial intelligence. Physicians can be supported in making decisions about diagnosis and therapies. It's about supporting experts in deciding on the right diagnosis or treatment. The hope associated with this is that healthcare staff will gain time to focus on the essentials, direct interaction with the patient. What is important? The use of innovative technologies is not intended to replace any physicians, but it is to complement them and contribute to more precise and personal care. From our perspective as the Ministry of Health, it is paramount that evidence-based findings from research are quickly transferred into care. It is important that researchers receive data from their patients' real situation in order to be able to formulate research questions in the most targeted way possible. Both scientific progress and care, as well as the use of artificial intelligence, can only be achieved if we improve the availability of reliable data and its usability. As a first step, we want to do this for social data already collected by the statutory health insurances. To this end, we will make the already available billing data more easily and quickly accessible. In addition, we will further develop the current data processing unit into a research data center. This is part of the bill which will be today hopefully adopted. With this, more data will be available for healthcare research. As part of the German government's artificial intelligence strategy, a total of 500 million euros have been made available. The Federal Ministry of Health received 16.5 million euros for projects bringing research into practice. Specifically, we want to support projects that we identify through a digital innovations framework announcement. When we talk about the use of artificial intelligence and when we talk about data use, we cannot stop, of course, at our national borders. After all, it is precisely in areas such as cancer research, personalized medicine, and the fight against rare diseases that it makes most sense to pool data, at least within Europe. In this way, we can expand the databases and benefit from each other. For this reason, Germany would like to use the German Council presidency in the next year, in the second half of 2020, to pave the way for a common European health data space. This will enable us to remain competitive in the development of artificial intelligence applications. We do not want to become dependent on other countries or regions for the access to high-quality health data. In Europe, we share common values and common legal framework. This should not hinder our success, but should become an international competitive advantage, especially in the highly sensitive healthcare sector. We will therefore work together with our partners on a common understanding for the use of data in the healthcare sector and suggest the development of a code of conduct under the use of health data. Dear ladies and gentlemen, to return to the initial question, how does Germany design patient care with the help of digitalization? We are doing this with fast access to digital healthcare applications and the electronic health record. In this way, we make the benefits of digitalization tangible for the patients. I would be delighted if you could count on your support and assistance in this regard. I thank you very much. I wish you a wonderful day, and I think I deserved my gingerbread. Thank you very much.